The Ford government released a 6-page plan today on the return to school this fall. Masks indoors will remain, class sizes stay the same, and as kids return to the classroom 5 days a week, they'll also be able to go on field trips, attend assemblies, and sing indoors once again.
Remote learning will still be made available by school boards, and that has some parents wondering if schools will be safe enough to send their kids again. Let's get some reaction now to this plan. Welcome to CP24 tonight, pediatrician Dr. Dina Kulik, who's the founder and director of Kid Crew. Thanks so much, doctor, for joining us tonight. I guess, your first look at this plan, what were your big takeaways?
I think it's great that kids will be heading back to school. By and large, missing school, it's been a very challenging time for a lot of kids for their mental health and physical health. I think a lot of kids are excited. My kids are excited. A lot of parents are excited. However, there are still some concerns and some questions raised by this report. And what would those concerns be? Well, there seems to be a lot of attention paid to fomite transmission or cleaning of surfaces, and that really isn't the predominant way COVID-19 spreads. We know it's to spread through aerosolized droplets. Ventilation remains a really, really key part, and a lot of schools still fall short in providing adequate ventilation for our children.
There's also the concern about kids with masks on with one teacher, but then during lunch or recess, they could just go out and mingle with everyone else. They didn't refer to unvaccinated children in their announcement today. Do you think they should have, doctor? Well, it's a challenge because all kids less than 12 are unvaccinated. So while a lot of high schoolers might be vaccinated and therefore more protected against this illness, all children less than 12 are still vulnerable to this. So while they will be cohorted in their classroom, while they're in their classroom, cafeterias are open to everybody. The busing situation is open to anybody with a full bus if that happens, as well as masks and choir classes without masks. And outside of recess, cohorts will not be contained. This poses significant risk to transmission between cohorts and potentially really rapid.
I wonder, too, about management of outbreaks and affected cases. Sort of a hint last week that there will be different rules for students who are vaccinated and students who are not, but really no mention of that today. They say that that's forthcoming. That seems to be, pretty important in terms of encouraging people to be vaccinated ahead of the beginning of school.
Of course, yes. Kids less than 12 can't yet be vaccinated. It's not yet approved for that age group. So all of our children in elementary school are not going to be vaccinated yet. There's no mention of what happens if a child is sick. Do they quarantine? For how long? Do they test? When do they test? What happens to their siblings? How long does everyone have to stay at school for? Plus, now it's going to be passive screening. It's up to the parents to screen them. There's no real active screening process. And so a lot of kids, the thought is, might end up going to school and they're not well. And then what? It puts a lot of undue burden on administrators and teachers. What happens if a kid comes and they have a runny nose? What do we do with that? What do we do with the rest of the class? It's a lot of questions still have to be answered.
One of the questions that seemed divisive among my parent friends, I thought it was great that kids are going to be singing indoors again, but I don't know if it's safe to celebrate that yet, Dr. Kulik. What do you think?
I don't know why we're asking things that we know are high risk. We know that aerosolized droplets happens more singing when we're close to one another, when we're inside. These are some things that I don't understand why we have to bring back right away. Can we get back to school, have our kids in school enjoying themselves, and bring back the higher risk activities once we know that they're safe and doing well, versus all at once bringing back these higher risk activities like busing in big cohorts, like minimizing, the social distance of kids when they're outside, like cafeterias that are full. I think we should be a bit more slow and cautious here to make sure we don't have this very quick spread of COVID-19 and then risk another lockdown.
Vaccines and the reliance on the community being safe and the cases in the community being low and those vaccination rates being high. How much comfort do you take in what you're seeing right now in terms of the number of people that are being vaccinated, and especially those elementary things where none of the students are able to be?
Right. Well, no one's going to be mandated to be vaccinated, including teachers and administrators and high schoolers that can get the vaccine. We're still a ways off of vaccinating all these young children as well. So, of course, all elementary schools will be filled with kids vaccinated because they simply can't receive the vaccine yet. It poses a risk for sure. I could tell you we've seen a dramatic rise in the amount of viral illnesses in the last couple of weeks, not COVID, per se, but a lot of kids with fevers and stomach flu symptoms and croup, a lot of stuff is going around, which tells me that kids are in close contact even now, even outside. So the concern for many of us is once we head back inside, and if we're not maintaining close cohorts and minimizing contact with other people, masking, social distancing, all the rest, that we could see a spread of COVID-19 in schools. And that would be a huge problem if we're not cohorting properly.
And I guess it's up to the public health unit to decide what's considered an outbreak, what would close a classroom or a school. That's yet to be determined now as well. Dr. Kulik, what do you make of this Delta variant then, its transmissibility and possibility that it gets into our schools when they open in September?
I wish I could say I'm not worried about it, but I am. I mean, we see around the world, the United States has a major problem right now, not just with adults that are getting Delta strain, but also tons of kids too. The south of the United States has tons of kids that are hospitalized and very sick with the strain. Of course, these kids are not yet vaccinated. So if there's any element of COVID-19 spread in the community, they are still at risk. And indoors, and sometimes without masks, this can spread quite quickly.
Watching the press conference today with Dr. Moore and sort of following along the commentary and reaction on social media, interesting to see a lot of people picking up on his suggestion that we need to normalize COVID-19 in schools. A lot of people taking that maybe different than what he intended the message to be. But he was making some parallels to the flu, for example. Do you think that might be dangerous to be putting out the idea that we need to normalize COVID-19 in schools, that people may let their guard down after hearing that from the province's top doctor?
Well, certainly every year we have lots of viral infections, including influenza, and kids get the flu, and by and large, they stay very healthy. And that's also true currently for COVID-19. Most kids with COVID-19 stay quite well. However, it is more easily transmissible, and it has around the world caused a lot more illness and death than the flu each year. So as long as the kids remain quite well with COVID-19, I think we can liken it to the flu, but it spreads much more rapidly. It could spread to our family members, even people that have been vaccinated, perhaps. And with new changes and different variants, it could become more of a concern. We've seen each and every strain tends to get a bit more virulent, more contagious, potentially cause more illness. We have to be careful of that.
Right, and it doesn't go away like the flu does, right? The flu comes with a season, but we're being told that we have to live with this.
That's true. So influenza is very seasonal, usually the fall and the winter, and then it's gone for the rest of the year. COVID-19 does not have that same trend. It's been here for the last 2 years.
I also want to ask, before we let you go, Doctor, about class sizes. That's something that a lot of people have been advocating for throughout this entire pandemic, and that the government has sort of been resistant to do. We're not seeing that in this plan, but the suggestion has been made that with cohorts, little mobility between the students within those particular cohorts, that they're sort of achieving the same sort of thing in terms of management of potential virus spread. Would you agree, or would you have liked to have seen class sizes reduced?
I think class sizes being small is one piece, making sure that there's adequate ventilation, good cleaning strategies. But to keep classes small, but still have the entire school potentially in one cafeteria, many different cohorts going on buses together with the buses filled to the brim, having assemblies with many different cohorts there, it doesn't make a lot of sense to limit class sizes and not limit cohorts interacting as we are seeing in this plan.
Okay, Dr. Kulik, great to have you on CP24 tonight. Thanks so much for your time.
You're welcome.
Thank you.